I'm Dr. Don Jenkins. I'm a trauma surgeon here at the Mayo Clinic at St. Mary's Hospital, and I am the trauma director for the Level 1 Trauma Center. In November of 2009, the American College of Surgeons visited Mayo Clinic and subsequently has verified our Level 1 Trauma Center as an adult trauma center once again in a 3-year re-verification cycle. The great news is that we have now an independent Level 1 Pediatric Trauma Center as well. This is a new category that the American College of Surgeons has created to designate a pediatric center of excellence that provides absolutely the highest level of care possible for injured children. We have specialists in every discipline needed to care for children that have been injured, with the exception of major burn injury. And the state does rely on its burn center in the metro area for all major burns to be cared for. With that exception, our pediatric trauma center is always ready to care for the most injured children with the worst types of injuries. We have a very comprehensive program that includes rehabilitation of injured children. We also have a very robust prevention program in order to try to prevent injuries from happening to those children in the first place. The American College of Surgeons not only verified that we had the highest level of care available, but also that our outcomes were as good as could be expected for the severity of the injury of those children. This is a national benchmark that has been achieved in very few centers in the United States, and certainly we are at the forefront in this trauma region.
Trauma is probably the most important disease in childhood. Kids are healthy. Kids make up about 1/4 of the population, but only occupy 5% of hospital beds. That means they're healthy. Once you finish infancy, children really have a 50,000-mile warranty. You really don't start getting sick until your 40s or 50s. Between then, children are really quite immortal. So it's really accidents, unfortunately suicide and homicide, that are the major problems with childhood. Because of that, we think it's really important to have a system in place to treat children who are injured, because injuries and the health problems that come from injuries outnumber the 5 next most common causes of serious problems in childhood. Put together, it outnumbers them. The second most common cause is cancer, and cancer is outnumbered 3 to 1 by accident, suicide, and homicide. A pediatric level 1 trauma verification is really important. What it means is that the people are ready, available, on the scene to treat injured children immediately. That doesn't mean that folks might come. It means that folks do come. It means that we have the resources in the hospital immediately available as well. We're not calling folks in from home. The scanners are there, the operating room is ready, the blood products, if we need them, are ready. We have specialized pediatric pharmacists. Those are the people to deliver the drugs. We might need to actually elevate the blood pressure or reduce the blood pressure, might need to actually cool some kids down, or here in Minnesota, warm them up. But all those devices are ready exactly on the spot to go as soon as the child shows up. We actually kind of stand around the trauma bay waiting, and we have a little video camera that shows a helicopter landing. We kind of know it's on the roof. We can see that they're ready to come on down, and everybody gets gowned up just like on ER, and the child comes in. We get report. It's kind of like that sterile cockpit in the airplanes, where we're not talking unless we're talking about the child. Child is absolutely #1 priority and focus. A lot goes on in that first 15 minutes. It's scripted what we do. Again, as a level 1 trauma center, it's all written down and codified. And then after it's all done, we review it. We actually sit down and say, did that go well? Did it not go well? What could we do to improve it? And then we have a whole process after that where we actually have written things down to say, gee, you know, we would like to watch this aspect of the trauma. We'd like to make sure that the child got exactly the right amount of fluid at the right time. And then we'll go through the records and make sure that happened. And if it didn't, we'll make corrections on that. Those are just some of the aspects that a pediatric level 1 trauma program means. It means you have a children's hospital. It means you have specific pediatric specialists who care and treat children as their profession. They've trained in it. They have special qualifications for kids. And we all work together, recognizing each other's expertise. As a pediatric level 1 trauma center, Mayo's involved in multiple injury prevention programs. This is part of the business of a child as you get into injuries. And it's really our job to point that out. We use the word accident as if, you know, kind of it can't be predicted, but actually accidents in some ways can be predicted. There are patterns. We know bicycle accidents, for example, they're more common in spring and summer months. It's usually young males that are involved with it. The time of day is usually between 2 and 6 p.m. It happens more in urban areas than in rural areas. And we know about the types of injuries. With that kind of data, we can go out and talk to kids and say, you know, you should be careful at these times, wear your helmet, here's some bike safety tips for you. And that's just a small example, because trauma it can be predictable and can be prevented. Go out into the schools. A big time is high school prom time. Lots of kids out there. We have injury prevention coordinators who will go into the schools, give presentations, kind of give examples and show what can happen, so that, you know, kids are on, you know, can be forewarned and prepared for what will happen out there. Driving is a big deal. Wearing helmets is a big deal. Understanding about bicycle safety, water safety, fire safety. A lot of what we do happens in partnership with community and with the community emergency resources. We all would like to work together on injury prevention, especially in kids, because it's so important. About 40% of the children who are injured don't make it into the hospital because they die in the field. We can drop that number down by really good injury prevention efforts.